My name is Ericha Worple. I'm one of the general surgeons here at UnityPoint Health, Fort Dodge. So I chose surgery, specifically general surgery, because of the ability it allows me to practice medicine very hands-on. I also enjoy the anatomy that you get to see being a general surgeon. And in surgery, you typically get to your patient's results fairly quickly. So they come in with a problem, we do surgery, fix it, and they're feeling better. My journey to medicine started with my undergrad degree. I went to University of Wisconsin-Madison. Once I decided I wanted to be a physician, I went to Des Moines University, or DMU, down in Des Moines. During my medical school, I actually spent some time here in Fort Dodge. To complete my training, I went to Geisinger Health System out in Pennsylvania, and I completed 5 years of a surgical residency. And once I finished that, I started my practice here in Fort Dodge. So a typical day for a general surgeon is I see my patients that I have in the hospital in the morning, and then I will either see patients in clinic or proceed to the operating room or endoscopy suite. If I go to the operating room, I'll be doing several surgeries throughout the day, or if I'm doing some endoscopy, it would be a screening colonoscopy or screening endoscopy. And then of course, call is always sprinkled in, so if patients come into the emergency room and need a general surgeon, we take care of those patients as well as those who are in the hospital. To approach patient care, one of my mentors has always said, take care of your patients as if they're your family member. And that always resonated home with me. So when I see my patients, whether it's in clinic and a routine procedure or in the emergency room, and is a scary situation for the patient and their family, I'm always approaching my patients as if they were one of my own family members. Throughout your education, you see multiple different health systems. I had visited UnityPoint as a student and spent time here, and then I completed my residency in a different health system. UnityPoint's patient-centered approach really resonated with me, and the availability of staff and physicians, as well as just the teamwork that takes place in the hospital and on the floors and in the clinics is really second to none. In general, a good time to reach out to myself would be if you are having some pain after you've been eating, specifically fatty foods. Usually the pain's located kind of in the right side of your abdomen, radiates to the back. Those can be symptoms of problems with the gallbladder, and we work those up and can help solve that with a gallbladder surgery. Other things would be inguinal hernias or umbilical hernias, so new pain in the groin when doing strenuous activity. Other things that would be a good time to see a general surgeon is when it's time for a routine screening colonoscopy. So a simple outpatient procedure can help prevent colon cancer. This is B. This is who I spend my time with, along with her big sister Reese. Typically when I'm not in the office, I'm spending time with this cute little girl. I'm hiking the trails and parks around Fort Dodge and Humboldt area. Know how much you matter to this world.